Okay, hey Amanda. So here's what I want you to explore with a band, okay, that we can hang from a tree. So these are like pull-up bands. What I want you to explore, and if you're already doing something like this, then that's fine. Just move through it. But relax your leg into the band. That's suspending your weight, so you can really focus on relaxing your quad and hip in front of your hip, and then begin to explore the relationship of the femur inside the hip joint. So you can, rotate the plant or the suspended leg. You can apply like really light pressure, like 10% effort in any direction that you feel the tension. So engage real gently, 10%. And a further progression could be holding your breath for 10 seconds as you contract for 10 seconds in the specific direction that's isolating those fibers. Okay, and while you're doing that, you should focus on relaxing the muscles along the outside of your leg, because it's called reciprocal inhibition. So by engaging an adductor, the agonist and the antagonist muscle is going to naturally have to relax. So we're just using that principle and focusing on the relaxation aspect, not the contraction. So I'm engaging my adductor, but my focus is on that lateral hip, letting go and relaxing. So you can play around with how to do that best as far as what position the femur sits, because basically the position that feels best is the best position. So if, whatever angle feels like it's, okay, that's really challenging your pattern, engage really gently in that position. Okay, you can hold your breath, 10%. And you're focusing on the same thing. Like, what else can you relax beyond what you're engaging? Because you're engaging, that's the firing pattern, so that's what you need to recruit. The rest of the body can relax because you're not necessarily targeting it or needing it to engage. So it's fine-tuning what you're paying attention to internally as far as which muscles are engaging and which muscles can we relax. Okay, so just play with that. You can also do the complete opposite, which would be to apply pressure engaging that side that's most tight, which is that vastus lateralis for you. So we're going to engage that really gently, noticing what all is engaged. My right quad to find balance in my hip, a real gentle contraction, and letting my foot dangle suspended. And you can be dynamic. I can use little micro movements suspended as I engage. I can play around with the amount of engagement. If I want to do more, a little greater force and really activate it. And then in that activation, continued dynamic movement. And basically bring as much blood flow into that area and fatigue it. Because when it fatigues, it relaxes. So this is really a higher repetition, longer duration. So 25 to 50 repetitions, and if you slow it down, if you do micro movements, the whole experience is to relax into it and feel the connection of your entire structure. Okay, so that's targeting vastus lateralis. And then we've got the linear or the specific. So I would start Let me adjust. Okay, I would start right above the knee on the outside below the IT band. That is probably the best spot to begin. And you can take the specific activator, you can find the position that I'll rock my leg onto and really feel that specific area getting targeted. Okay, so I'm putting it right above the knee behind the IT band. And that area guaranteed is tight. Okay, so you start really gently, feel the pressure at the least amount of force possible, okay, that you can relax to. So as gentle as you can make it, you're developing your sensitivity to pressure. So feel what that minimal amount of tension, direct pressure, focus feels like, and then work on cranking it as you're able to relax up to about a 5 or 6 on a scale of 10. That's where you can, that's where I find I can just continue to relax as I press. So currently my muscle is melting as the tissue, as the direct pressure penetrates deeper in. It just continues to release as I allow it to, and use your mind to do that, help you do that. And as it begins to unwind, the body will naturally say, okay, now go deeper. Okay, so then you'll slowly find what direction the pressure can go in, which is tissue preference. So if I want to rock forward, backwards, left, right, which direction, if I'm targeting one spot specific in that region we talked about, does it feel like the body enjoys it more? So go into that direction real gently, just a little bit of a tug, and then again focus your breathing on sending the blood flow and oxygen to the area, and visualize the area going from a cord to a garden hose. So I'm your host, Tate Yoder, with 2 bands and a tree. I'll catch you on the next episode, where we'll be targeting glute medius. That's another big culprit in that hip syndrome. Okay, so basically what you do is continue following up that, I call it the golden channel, but it's right underneath the IT band. It's your vas lateralis, and it goes all the way to the IT band. And you follow it and just go up a little bit, target another spot, and begin the process again. And just continue to think of it like an onion getting peeled, and you're just penetrating deeper into the fibers to get them to open up and let go. And that's tissue transformation, because then you can go as deep as you possibly can 3-dimensionally and put as much pressure as possible while you're still remaining relaxed, to get as deep as you can through that healthy muscle tissue now that's been totally released, down to the fibers closest to the bone that are still problematic. Because when you can target those 3-dimensionally to the bone, you've got a transformed muscle. All right, so engage, relax. You can do some of the muscle activation. So if I press real gently into the pressure, that'll intensify it, and then relax. Okay, and then this is kind of like a PNF actually, in a way. So I'm pushing in to facilitate the nerves within the tissue to be stimulated. That's it. I'm trying to stimulate the nerve signals within the fascia, which is the most superficial layer of tissue. So it's a real gentle directional fray, like a shear, that you respond to. You feel that nerve impulse, and then that sends signal throughout your whole neuromyofascial web, which is when you can have a whole muscle structure release instantaneously, because communication through that fascial network has the ability to send that type of signal. It's called the cascade of healing, but it'll open up the whole network and unwind the whole connection throughout a whole muscle group, which is an exquisite feeling. So, all right, that's good enough for now. Good talking to you. Let me know what you think. Get back to me, and we'll go from there.